Okay. Hi, my name is Riley. I'll be your student nurse today, working with your regular nurse. I'm just going to be performing a brief assessment. And do you have any concerns or questions before I get started?
Nope.
Okay, so I'm just going to read her vital signs. I have a little card with them on it. So her vital signs were 36.7 for her temperature, 14 for her respirations, 67 for her heart rate, and 112/76 for her blood pressure. All right. On a scale of 0 to 10, how would you assess your pain? 0 being none and 10 being extremely painful.
0.
Perfect. So before we get started on our assessment, I'm just going to ask you 3 questions. What's your full name?
Natalie Murray.
Perfect. What's today's date?
The 23rd of October.
Yep. And where are you right now?
A bedroom.
Perfect. So clearly my patient is awake, alert, and oriented to time, person, and place, which is all very good to get started. So I'm going to start with your neurological assessment. So I'm just going to grab this. Oh, not to mention, since she is answering my questions with no speech issues or anything like that, we can tell that her mental capacity is clear and appropriate. So I'm going to be testing Perla right now for her first part of her neurological assessment. And I'm going to be testing constriction and accommodation. So for constriction, I'm going to shine my light in one of her pupils, and I'm going to watch for that pupil to constrict. And then when I do it again, I'm going to watch for the other pupil to constrict, and then I'm going to do it to both sides. All right, so just look forward. Perfect. Awesome. And just one more time, or 2 more times. Wait. Very good. Okay, so every time I shine the light, when I was looking at her direct eye, the pupil constricted, which is good on both sides. And then when I did it and looked at the other eye on both sides, the pupil constricted. So this is a good finding for constriction. Now we're just going to be testing accommodation. So I'm going to have you look at my pen light, and then look at the wall behind me, look at my pen light again, and look at the wall behind me one more time. Okay. And then at the wall, then at the pen, and at the wall. Very good. So again, when she looked up close at my pen, her pupils constricted. When she looked at the wall behind me, she had dilation. So this is a good finding for accommodation. Next, I'm just going to be assessing your grasp. So if you could just grab my 2 fingers with both of your hands and squeeze as hard as you can. Very good. So her strength is clearly a 5 out of 5. Very good. Nothing wrong with that. And it was symmetrical on both sides. Now I'm just going to be having you do some facial movements. So can you just raise your eyebrows? Can you flare your nostrils? Can you puff out your cheeks? Stick out your tongue? Wiggle it from side to side? Perfect. So she had symmetrical movements on her face on both sides, and she had no drooping or anything, which is a very good sign for that test. Next, I'm going to be moving on to your cardiovascular assessment. So in order to do that, I'm just going to listen to your heart. And again, when I took her heart rate the first time, she had a normal rhythm. Nothing was wrong with that when I took her vitals. So if you could just take a deep breath in and out for me. First, I'm going to listen to your aortic. Good. And then your mitral. No. Excuse me. Your pulmonic. Good. And your tricuspid. And lastly, your mitral. I'm just going to switch up your shirt. Very good. So her heart sounds are very clear, very normal, no murmurs. And now I'm just going to listen with the bell of my stethoscope, and just listen to the tricuspid and mitral valves. Perfect. So again, that was listening for S3 and S4, no murmurs or nothing was wrong with that. Now I'm just going to be testing your dorsalis pedis pulse and your posterior tibial pulse. So if you could just lay all the way back for me. So first I'm going to test your dorsalis pedis pulse. Awesome. Cool. So they were a 2 out of 3 on both sides, which is very good. And onto her posterior. I'm just going to go on the inside of the ankle here. And just go like that. Good. Again, a 2 out of 3. equal on both sides. So that looked really good. Next, I'm just going to move on to your skin. So if you could just sit up for me again, perfect. So first I'm going to assess the color of your skin. She's clearly Caucasian, so she's fair, pale, which is all very normal finding. Next I'm going to do sensation. So I'm just going to have you close your eyes. I'm just going to poke you on a part of your body. You could just tell me what part of your body that is.
Arm.
Which arm?
Oh, right arm.
There you go.
Left arm. Left leg. Right leg. Tummy. Chest. Neck. Forehead.
Perfect. All right, so sensation was clearly very good. So color and sensation were good. Movement, I'm just going to have you wiggle your toes for me. And roll your ankles. Wiggle your fingers. Roll them out. Your wrists. Perfect. So clearly her movement is also very good. So this is a good finding. And there's no edema. Nothing was wrong. She looks good. Next, I'm going to move on to her pulmonary assessment. So I'm just going to start by saying her respiratory rates were within normal limits. It was a 14, and she's clearly not in any sign of respiratory distress and has no labored breathing or any difficulties with that. So first I'm going to auscultate you anteriorly. So if you could just take deep breaths in and out. So I'm going to start by doing your right apex. Breathe in. Oh, actually, I'm going to switch. All right, breathe in. All right, left apex. Good. Left upper. Right upper. Left upper. Right upper. Good. Now I'm just going to do you laterally. So I'm just going to have you face the wall this way. So I'm doing her right side. So I'm just going to have you lift your arm above your head. Perfect. So I'm going to do right upper, right middle, and right lower. Good. And can you just do the same thing on the other side? Left upper, left upper, and left lower. Good. Okay, I'm going to do her posteriorly, but before I do that, I'm just going to say that all of her breath sounds were clear to auscultation, and there was no adventitious breath sounds, and it was bilaterally, so she had no problem. They were symmetrical on both sides. So I just want to say that before I do posteriorly. Okay, posteriorly, I'm going to do left upper, right upper, right lower, left lower, right lower, right lower, and then left lower, right lower, and left lower. Good. Again, no clear auscultation, no adventitious breath signs, and this was these findings were bilaterally. So next, I'm just going to assess your abdomen, or your abdomen. So if you could just lay back for me. I'm going to ask you a few questions before we get started. So, are you having any trouble passing gas?
No.
Have you had any recent bowel movements?
Yeah.
Okay. And was this soft and formed, your bowel movement?
Yeah.
Yep. Okay. And then are you having any problems with nausea or vomiting?
Nope.
Okay, perfect. So I'm just going to assess your abdomen. So the abdomen split into 4. So I'm going to listen first for your bowel sounds. So this is your right upper quadrant. Your left upper quadrant. Your right lower quadrant. And left lower quadrant, sorry. Perfect. Okay, so she had active bowel sounds. There's nothing wrong with that. They were not hyper or hypo, which is all good. And now I'm just going to palpate your abdomen in the 4 spots again. She's really ticklish, so she might laugh, but I'm going to try my best. Okay, I'm just like, I'm not even going to press. I'm going to pretend like I'm pressing. No, I'm going to press. I'm sorry. Okay, good. I'm sorry. Okay, perfect. Okay, so her stomach was non-tender, non-distended, but soft. That was all very good. You can sit up for me again. Now I'm just going to ask you some questions again. Are you having any pain, frequency, burning, or urinary retention issues?
No.
Okay, sounds good. So if my patient was in the hospital and had a Foley catheter in, we would be seeing 30 cc's of urine every hour, but clearly she does not have it in right now, so she's all good. Next, I'm just going to look at your skin again. So I'm looking for mobility, sensation, if there's any breakdown, any friction areas, anything like that that could cause any problems. And I don't see any, so her skin looks really good. That also looks good. So lastly, I'm just going to give you a little bit of a patient teaching point. So obviously in the hospital I would have this printed out, but I have it on my computer here, and I'm going to be teaching her about a breast exam. So I'm going to, if this was in the hospital, I would give her the pamphlet or the papers that I have, and I would just go over all of them basically, and the one that I have up basically is just giving you step by step how to look in the mirror, how to touch your breast, and how to feel for if there's any lumps, any drainage, anything that looks wrong basically, which is all very good just to make sure, you know, everything's right there, and like if there were to be anything that you could catch it early, anything like that, it's going to tell you who to contact and what to do if you do find any lumps or anything along those lines. But yeah, so that's about it. And then I'd ask her if she had any questions, answer her questions before she would leave, anything like that. So yeah, that's about it.